Our understanding of how the coronavirus is spreading continues to evolve. We want to take this moment to clarify much of the latest scientific thinking. First, a report from Stephanie Sy, followed by a conversation with William Brangham.
The coronavirus can remain infectious on plastic and steel surfaces for up to 3 days.
That has many people worried about shopping and other everyday tasks.
You got to be putting that disinfectant on these groceries.
This was the sound of fear early in the pandemic, after studies showed that the novel coronavirus could live on surfaces for hours, even days. It led to a furious wave of scrubbing, disinfecting, and sold-out cleaning supplies across the country.
But the problem with those experiments is that they didn't relate to what a real-life scenario would be like.
That's Dr. Emmanuel Goldman, a microbiologist at Rutgers, New Jersey Medical School. In July, he published this article in the British medical journal The Lancet, arguing that these early studies greatly exaggerated the amount of virus that could actually be found on surfaces in the real world. He pointed out that the lowest amount of infectious particles researchers used to test surfaces in the lab was 10,000, a huge amount.
You'd need something like 100 people coughing or sneezing on the same small surface area to get anywhere near the amount of virus that they used in these experiments.
He says these mistakes and a lack of scrutiny have siphoned limited resources from everything from subway systems to schools for excessive deep cleaning that shows little evidence of helping prevent COVID spread.
Our mothers taught us, you go to the bathroom, you wash your hands. You prepare food, you wash your hands. You touch something dirty, you wash your hands. That's all you have to do. Normal, routine hygiene is sufficient to protect against this virus.
Meanwhile, he adds, not enough money and attention have been paid to what we now know is the primary way the virus travels, the air.
A teacher from a school system saying they were going to shut down the schools 1 day a week for deep cleaning and disinfection. Wouldn't it be better to use it instead on ventilation systems or hiring more teachers so you could have fewer students per class?
You want to try to replicate the outside indoors in your space.
Dr. Shelly Miller is an environmental engineer at the University of Colorado Boulder. For decades, she's studied the way pollutants and infectious diseases spread in indoor spaces, and over the summer helped her own university prepare for when students and faculty return to campus.
You want to control the source of the contaminant. And in this pandemic, the source are the infectious people inside. And so to control the release of virus, you want to wear a mask, and you also want to be outside of their personal cloud. But some of the virus can potentially leak into the environment, and then you have to clean the environment. And the way to do that is with filtration and ventilation.
The simplest way to do that, she says, open a door or window. But in many parts of the country where it's still too hot or becoming too cold to do that, Miller says there are different ways to increase a building's mechanical ventilation and filtration. Here's a basic guide. Buildings up to code should already be replacing the inside air with outside air 3 times an hour. But with coronavirus, that should be doubled to 6 exchanges per hour, and ideally to 9 exchanges per hour. And crucially, the more people there are contained in a space, the more exchanges are needed. HEPA filters, which stands for high-efficiency particulate air, should also be added to ventilation systems to increase protection.
If I walk into a restaurant or a classroom, is there a way for me to personally tell if that is a safe place to be, if there's enough ventilation?
Unfortunately, at this point in time, no. And that is why a lot of times I've been saying, well, we really need to address this. We need to give buildings and classrooms and other facilities resources so they can let the public know how they have attended to this.
She and others say the Centers for Disease Control and Prevention and the World Health Organization have been too slow to move away from early guidance on surface disinfection and towards clearer guidance on preventing airborne transmission. Last Friday, the CDC did add language on its website about aerosols from coughing or breathing spreading the virus and the need for ventilation, then suddenly removed it.
So the only rule of thumb I can say is if you walk into a space and it feels hot and stuffy in there, and you can smell smoke and you can smell different odors, then it's probably not ventilated enough, and you probably shouldn't spend very much time in there.
Even portable air cleaners can help, and Dr. Miller and her colleagues have created a guide for schools on these, which you can find on our website. The bottom line, if you're thinking about going back to the gym, to a restaurant, your office, or school, keep washing your hands, keep wearing your mask, and keep social distancing. But don't fool you. Ask what they've done about the air.
The problem is that it's been out there for so long, and as Shakespeare said it the best, what's done cannot be undone. And it's going to be a long time to turn this ship around, if ever, because a lot of people still are operating on these assumptions.
For the PBS NewsHour, I'm Stephanie Sy in Phoenix.
For more on what we're learning about just how this novel coronavirus gets inside our bodies, I'm joined now by Dr. Lindsay Marr. She's a professor of civil and environmental engineering at Virginia Tech, and her expertise is in the airborne transmission of viruses. Lindsay Marr, very nice to have you on the NewsHour. Could you help us initially with this a distinction over terminology? People have been hearing about aerosols versus droplets. What do those things mean, and why do we really care about them?
Droplets and aerosols are really a kind of opposite ends of a spectrum. They really refer to the same thing, which is a droplet of liquid that comes out of your mouth. And when it's really large and we can see it, we call it a droplet. It flies through the air like a mini cannonball and can land on someone who's close to you, in their eyes, nose, or mouth. Aerosols are just microscopic droplets, and they come out of your mouth or nose, and they're small enough that they can remain floating in the air for quite a while. And those, rather than flying through the air like mini cannonballs, kind of float around like cigarette smoke, and just like that, you can breathe them in.
So people have been hearing a lot of different kinds of advice. Given what we're learning now, how should we be thinking about this virus as it circulates in the air?
We can think about it like cigarette smoke. So the distancing really keeps you out of range of those big droplets that fly through the air and then will fall to the ground quickly. They don't really fly more than 6 feet or so. But at the same time, for every one of those that you see, there's hundreds or thousands of the microscopic ones, the ones we call aerosols, and those can stay in the air, again, like cigarette smoke. So imagine you're interacting with a smoker. You want to stay as far away as possible from them, really, to avoid breathing in the smoke. The smoke doesn't stop at 6 feet. So 6 feet is a guideline, and it keeps you kind of farther away from the most concentrated part of the smoke, the plume, but it doesn't guarantee that you're not going to be exposed.
And I guess, too, that's a useful way to think about it if you're traveling in a car or inside a large room or sitting outside with someone. If I'm directly next to you and you're having a cigarette, I'm going to be sharing in a lot of that. But if you're sitting at a farther distance and it's breezy, that might lessen my exposure.
Exactly. The cigarette smoke is a great way to think about different specific scenarios. Whether you're indoors, do you want to be indoors with that smoker? Well, you think about what affects that is the ventilation in the room. If the room is really well ventilated and there's lots of outdoor air coming in, then that smoke will be kind of pushed outside. But if the ventilation is poor, that smoke can build up, just like the virus can also build up in the air. And exactly as you suggested, if you're outdoors, you're really close to someone and you're right downwind of them and there's not much wind, you could end up breathing in a lot of that smoke. But if you kind of move a little bit and it's really windy out, you would greatly reduce your exposure to smoke.
As we know, the CDC has been waffling back and forth about exposure, aerosols, droplets. For the layperson, does this going back and forth about their guidance have a real tangible world effect?
The only thing it affects is the guidance on ventilation. So whether it's droplets or aerosols, we still want to wear masks. We still want to maintain distance because masks and distance help reduce our exposure to both droplets and aerosols. Ventilation is the one thing, though, that really only matters if aerosols are important, because the large droplets are just fall out close to you, whether you have good ventilation or not. But the smaller things, the aerosols, that's where ventilation really matters.
Help me understand something else. We've seen President Trump has been recently holding some of these indoor rallies, very crowded, largely maskless, and he's been criticized for that. He and his supporters point to, well, what about all of these protests we saw, which were much bigger crowds, sometimes people wearing masks, but they're also yelling and crowded together. How do we know which of those things are risky? How do we measure the risk of those relative events?
There are two important differences between an indoor rally and the outdoor protests. The indoor rally, first of all, was indoors, where we know that virus can accumulate or build up in the air. There's less opportunity for dilution compared to being outdoors, for example, with the protests. The other important difference is that at the rallies, not many people are wearing masks. And so if someone there happens to be infected, then they are releasing a lot of virus into the air, which can float around and other people can build in. With the protests, almost everyone was wearing a mask, and so the mask prevents that virus from getting into the air. It also helps protect the wearer and reduces the amount of virus they might breathe in from the air around them. A third difference, actually, is that at the rally, people are standing close together and they're in the same place for a long time. I think with the protests, in many cases, people are moving around. This creates more space between them. There's more airflow. So that's another factor that would reduce the risk in the outdoor masked event.
All right. Dr. Lindsay Marr of Virginia Tech, thank you so much for your help.
Thank you very much.